Hi, I want to begin series of presentations on street drugs. I titled these street drugs one because this is where I'll be starting from. And first and foremost, my advice at the beginning now, which will be my advice at the end, would be don't do it. I repeat, don't do street drugs because it can kill you fast. They are mostly adulterated street drugs. Sometimes you buy fentanyl, but what is there is more than that. Please don't do it. It can kill you fast. When somebody has done drugs and the person is sick and you watch the person around you, or the person is already at the clinic or the hospital or picked up by those kind people called EMS service providers, when you check the skin, if the skin is pale, it's likely he or she has taken amphetamines or cocaine or LSD or aspirin, or it could be any other drugs but adulterated with any of these and even many more that could lead to pale skin. But if you check the skin and the skin is flushed, okay, if the patient can still talk to you, find out if he or she has taken anticholinergics, tricyclic antidepressants like amitriptyline, nortriptyline, and other members of that group. Find out about phenothiazines. Is this person on treatment for psychiatric disorder? Or has this person locked him or herself up in the garage and has inhaled carbon monoxide from car exhaust? Or this person is doing street drugs that is laden or adulterated with any of these or more. Flush skin, find out about that. If you check the pupil, if it is constricted, another word is meiosis, think of opioids. Think of opioids when you find constriction. Shine the light on the eyeballs, check the pupils, and if it's constricted, is it morphine? Can this be codeine? How about hydromorphone abuse? This person taking heroin? And if none of those is the cause, it's possible it could be alcohol, it could be barbiturates, can be nerve agents, and think of insecticide here, organophosphates. Think of adulterated street drugs with any of the above and many more, just by looking at the eyeballs, checking the pupils. If it is dilated, think of cocaine first. But if you can establish that cocaine is done here, think of all anticholinergics, either tricyclic antidepressants, amitriptyline or triptyline, Benadryl, antihistamines, atropine, ipratropium or tiotropium. Is this person an asthmatic patient or has asthmatic patients in the family and the person is stealing the meds? Or COPD on medication, tiotropium, and the person is stealing them? Or selective serotonin reuptake excess. This is somebody that is depressed and has decided to overdose and is now having serotonin syndrome, there'll be dilation. And it could be any other medication. It could even be fentanyl, but it's adulterated in such a way that cocaine has been added or anticholinergics has been added. And that is why street drugs are very, very dangerous. When you pick an item, you think that is what you are consuming. Lo and behold, you might be consuming a lot of chemicals at the same time that are not labeled. Not known to you. Actually, we have awareness now that people who do street drugs actually look for all these adulterated ones so as to get high. But then you can think you are taking fentanyl and cocaine is embedded, and you have all these troubles. Tachypnea, the individual is breathing very fast. You can think of opioids, yes. Think of carbon monoxide. Ask him or her about aspirin overdose, how about amphetamines, phencyclidine or PCP, and of course, adulterated street drugs. As a matter of fact, once you are dealing with one street drug, rule out the rest, maybe through toxicology screening, because most of the times they will be evasive. They will not want to supply the correct answers. Not knowing that that would be the only way for you as the health caregiver to save their lives or EMS service provider who is willing to save their lives. If there's hypoventilation here, respiratory rate is low, O2 side is down. Think of anything that can decrease muscle contraction. Means the lungs are not working well. Could be opioids, overdose. Could be sedatives, benzodiazepines and the rest. Could be organophosphates or other cholinergics, botanical and the rest. And could be muscle relaxants, maybe given for spasm or anything, and you've decided to take it beyond necessary. And I want to leave a note here. Some of these prescribed drugs that have been abused, your doctors know the right dosage meant for you. It is when you decide to go beyond that level for any reasons best known to you to get high or whatever that you then get into trouble. Snake venom can lead to hyperventilation. And of course, I will keep on repeating it. Adulterated street drugs. You might be taking cocaine, thinking you get high, and it's already laden with another opioid somewhere, and the trouble is just out of reach, out of control. Okay, if there's increased temperature, think of antipsychotics. As a matter of fact, when second generation antipsychotics like olanzapine, risperidone are prescribed, it is advisable to tell the patient that there's possibility of temperature dysregulation. So think of that. It could be anesthetic agents, acetylcholine, could be LSD, could be phencyclidine, selective serotonin reuptake inhibitor intoxication, and of course, adulterated street drugs. All this could lead to increase in temperature. But if it is hypothermia, I mean, the patient you're saying is having low temperature, opioids, find out. Sedatives, find out. Carbon monoxide, find out. Alcohol, find out. Many more drugs can give this, but find these four out first, then could be adulterated street drugs. The patient could just tell you, no, it's so, but who knows what else. Somebody has consumed alcohol before taking fentanyl, opioids and alcohol combine, and the temperature is just down. If it is hypotension, think of opioids and codeine, morphine, hydromorphone, oxycodone, fentanyl, and the rest of them. Think of sedatives, benzodiazepine, diazepam, lorazepam, chlordiazepam, and a host of others there. Cyanide. Cyanide poison could kill very fast. Cholinergics like organophosphates, and that's an insecticide, particularly our good people that are feeding us, the farmers. They have good intention to do it, but for one reason or the other, somebody goes to the farm and wants to end his or her life and takes this, could die from that. And adulterated street drugs will also lead to serious hypertension. If it is increased blood pressure, think of amphetamines, tricyclic antidepressant, cocaine, particularly cocaine will give very, very high BP, and even tricyclic antidepressants. They give arrhythmias, they give myocardial infarction in cocaine, acute coronary syndrome in cocaine, and you don't crash the BP in cocaine with beta blockers. We'll talk about that in details when we're handling cocaine. LSD, phencyclidine, otherwise called PCP. Pseudoephedrine, yes, I highlighted that because a lot of people will just walk to any of these stores, Walmart, Superstore, anywhere, over the counter, cold medication containing pseudoephedrine, just take it anyhow and shoots up the BP for them. And could be adulterated street drugs as well. Seizures. You know this person is doing drugs, but now is having seizures. You're confused. Could be nerve agents. Nerve agents. And that will kill very fast. Suman or VX, I don't know much about them other than what I found in literature. Amphetamines, yeah, cocaine, cyanide. These drugs could be embedded in some of these drugs you purchase along the streets. If you have any medical problem and your good doctors prescribe to you, they know what you need and they know the dosage. But when you walk to the street to get high, to get anything for yourself, you get more than what you bargained for, because they are given one pill by those people. You don't know how many things have been ground together, coated together, and embedded in one that could give you all this. In conclusion for today, for this presentation, because we have many more to talk about, don't do drugs. They can kill because they are mostly adulterated with unknown other drugs or substances. There will be more details on cocaine, amphetamine, methadone, fentanyl or opioids in general, marijuana, and alcohol. So please subscribe to my channel, and you are free to give me feedback on your impression and whatever you want us to talk about the more. But for the sake of humanity, stop purchasing drugs along the street, stop doing drugs so that you can enjoy your life, make your family members happy and proud of you, and be good example to younger generation. Thank you.